A Fox News alert. I'm Greg Jarrett, in New York. Conservative radio talk show host Rush Limbaugh speaking about his condition at a hospital in Hawaii. Let's listen.
Wednesday afternoon. The first thing I want to do is thank the people at the Kahala Hotel and Resort. The general manager there, Thomas Pauly, and their security staff reacted like that to my distress call at 2:30 on Wednesday afternoon. The people here at Queens Hospital could not have been better. I feel very, very fortunate. I've been treated to the best health care the world has to offer, and that is right here in the United States of America. Also, I'm overcome with all of the prayers, the cards, the flowers that have come in from people all over the country. It has been a very humbling experience. Now, all of my life, I've wondered what a heart attack would be like. I've never had any heart disease. I've never had any problem with it. At 2:30 on Wednesday afternoon, I experienced pain in my upper left chest like I had never experienced before. I sat down, I walked around, nothing abated. I got on the phone and called the security staff at the Kahala, and the security people were up there instantly. EMT came in instantly, and I think within 20 minutes I was here at the hospital undergoing extensive tests. They alleviated the pain problem within a half hour. And yesterday morning, I had an angiogram, which is a catheter treatment through the heart, and they found absolutely nothing wrong. It was a blessing. No arterial disease, no coronary disease whatsoever. Stayed last night for observation just to make sure, because their pain was real, and they don't know what caused it. And I think for everybody out there who I'm 58, will be 59 in a couple of weeks, and you start thinking about these kinds of things, don't mess with it. Or chest pain, and you have no idea what it is, and it's something you've never experienced before. Turn it over to professionals right off the bat. Don't tough it out. Don't try to make it go away on your own, because it's not worth the risk. Again, the treatment I received here was the best that the world has to offer. And I, based on what happened to me here, I don't think there's one thing wrong with the American healthcare system. It is working just fine, just dandy, and I got nothing special. I got no special treatment other than what anybody else would have called, been brought in with the same kinds of symptoms. The care was extensive, it was personal, and it was complete, and it was very confidence-inspiring. And I never, once I got here, had any fears because of the manner in which I was treated. My cardiologist for this, Dr. Magno, is here. I've gotten to know her very well in the last couple of days. She's actually also another cardiologist case who is not here. But they are the team. But the nurses, the support staff, the nurses' aides have made this stay a hotel, other than the problem I had with what I thought was the heart. I wish I knew what it was. There's all people can do is make wild guesses about it. Best was it been a spasm in artery, but this angiogram showed literally these are arterial disease whatsoever. For that, I'm very grateful, and it's a blessing in disguise that it happened as it did, with no damage whatsoever, because it takes things like this in life maybe to prepare you for the eventuality that you are getting as young as you were and not as invisible. I'd like to turn it over to Dr. Magno now, because she wants to say a couple things about this. And thank you very much for respecting no questions, because if we did questions, I know you'd ask questions I really don't want to answer in this setting about political circumstances. I just feel very grateful and thankful to be an American and have this happen to me at one of the best cardio hospitals in the world, where I happen to be here. It all worked out for the best. Dr. Magno.
Thank you. Thank you, everybody, and Happy New Year. I just want to make sure to reiterate what Rush said about the importance of calling for help as soon as possible. If you think you're having a heart problem, call for help. Call 911, get to the hospital, get to a doctor's attention, because time is very, very important. And the sooner you can get to good medical care for your heart, the sooner we know what the problems are, and the sooner we can treat it. Thank you.
Mr. Limbaugh, are you taking painkillers again for your back pain?
Didn't hear that. What was the question?
What was the question?
Are you taking painkillers again for your back pain?
No. Thanks very much. No, prednisone.
Doctor, say your name, please.
And so Rush Limbaugh, live via Streambox from the island of Oahu, where he was vacationing, went on Wednesday. He began to complain of chest pains. Unclear at the time whether he suffered a heart-related problem or something else. But we learned today that after an angiogram, which is basically injecting a radiopaque contrast agent into the blood vessels, and then you look at the heart through an X-ray machine type device, they found, according to Rush Limbaugh, no coronary disease. They don't know what caused the pain, but he did not suffer, he says, a heart attack or any kind of a coronary episode, so that's the great news. And of course, taking the time to make a couple of points, the best healthcare system in the world, in America, and he was the beneficiary of that, he said. And also, if you ever experience chest pains like this, and he described them as severe, don't take any chances. Do what he did and get checked out right away. So good news from Rush Limbaugh in Hawaii. I'm Greg Jarrett in New York. Now we return to Your World in Progress.
I'm not a crook.